Good afternoon, everyone. Welcome to our Ask the Experts.
Yeah, good afternoon. Happy October. We've had a full October, Erin.
We sure have, and we are not done yet.
We are not done yet. No, this is one of two Ask the Experts, and what an incredible event we have coming up for you this afternoon. So thank you all for logging in live. As we know, as with a little homework, we're watching the chat. So feel free to put those questions right in the chat because we're going to be watching that and asking our guests today to answer any of your questions. And of course, if it gets to be where we have too many, we will follow up and have this on our library so that all questions are answered.
Wonderful. Yeah, and we are so excited to have a speaker that joined us over the summer back again today to, as a true expert, giving her insight and tips on a really difficult, I think, conversation in general. So, how to manage tough conversations with children and family. And we have an expert with us today that has been doing this for all of her adult career, has worked with so many families and patients, and we are so grateful to have her back with us today. So, as Sue said, as we move through the conversation, if any questions come up, feel free to put them in the chat in Facebook. We will be monitoring that, and we'll be sure to pass those along.
Yeah, Erin, we're so honored to have Jean back because I do remember this first one feeling like, oh, I wished I knew everything that Jean was sharing, the resources when my kids were little. They are so valuable. And it's all about having the right tools sometimes, right? When you just can't
Yeah,
get your head wrapped around what to say.
yeah.
And that is why now we're bringing Jean back for a second time. So thank you, Erin, for setting this one up. It's an important one.
Absolutely. And so, Sue, I know that we assume most of our audience knows who we are, but just as a little introduction, my name is Erin Pellegrin. I'm our Senior Director of Nutrition and Education here at Unite for Her. So you likely see myself as part of our duo leading these education events each month.
Yep, and I am Sue Weldon. I'm the CEO and founder, and always honored to be Erin's co-host for these events. And a survivor of 20 years. I always want to put that in there, right? Because that is really how Unite for Her started, was out of my experience. And so honored to see us grow in leaps and bounds nationwide.
Absolutely. And we know that we couldn't do these each month without the help of our sponsors. So I will bring this up. Sue, if you can just let me know that you see this
Oh,
sharing.
sure. Yeah, perfect. And, we have
Wonderful.
some incredible lead sponsors here. Our presenting sponsors are West, Merck, and Daiichi Sankyo. We thank them so much for allowing us to do over 44 of these a year now that we added a Cafecito, a Spanish speaking one. It has just been able to, again, allow us to grow in ways that we are really leaning into and is needed in our community. And then our supporting sponsors are GSK, Lilly, Gilead, Pfizer, and Immunogen, which is now a part of AbbVie. So thank you to all of our sponsors who continue to be by our side so that we can be by yours.
Wonderful. And while we are, before we jump into this Ask the Experts, it is one of two that we will be bringing you this month. So if you are able to join us next week, Sue and I will be bringing you again a new topic that we are so happy to have another expert in her industry sharing. And I think this is something that not everybody feels comfortable talking about, and many of us don't even know is available to patients. So we will be joined by Mandy Soller of the Soller Institute, and she will be answering your questions and doing a little demonstration all about cosmetic and medical tattooing. So she'll be answering questions about eyebrow work, nipple tattooing, scar microneedling for medical purposes, how she can improve eyelashes, hair thinning with scalp micropigmentation. We've come such a long way. So it's great to have her sort of share what's available now.
Yeah, and she actually did my nipple tattooing 11 years ago. And I remember that day when Mandy, I never had anything done. So for 9 years, when I would walk by that mirror, it is a reminder, right? You always see the scars and you get used to it, right? But boy, when I ended up getting these 3D nipple tattoos done, I remember going like, wow, okay, I'm not looking at those scars anymore. She is remarkable and an expert in her field. and so much new now, Erin, in this space. And I think about my port scar, and they are now doing things for the port scars. And I'm like, I had no
Mhm.
idea this was available. So I will be sitting in the chair actually on the 30th at 4 o'clock. So come join us. And she's going to be doing the tattooing on my eyebrows, which I don't have much of anymore. And we're going to be doing a demonstration live.
Yeah, wonderful. And so feel free to ask your questions for that topic as well. I know we've got a few already that our community has submitted, but plenty more time to inquire some more about what is available there. So we'll pop that link into the chat so that you can submit any questions that you may have.
Perfect. All right, Erin, are we ready to introduce our guest?
Yeah, I'm so excited to have her back.
All right, you go ahead. I'll let you take it from here.
Perfect. So, as Sue mentioned, we are so honored to have Jean Hartford-Todd with us again for our Ask the Experts this month. Jean has been a child and adolescent life specialist at the Duke Health System for more than 36 years. She began working at Duke Health on the inpatient pediatric units in 1986, working with children and teens who were hospitalized with various serious injuries and illnesses. In 1996, she began working at the Brain Tumor Center at Duke, focusing on the needs of children and teens who have a parent with brain cancer. In 2013, she joined the Duke Cancer Patient Support Program and expanded her services, offering psychoeducational support to all adult oncology patients treated at the Duke Cancer Institute related to the needs of children and teens in the family. She's also co-director of the Kids Can support group for children and teens who have a parent with cancer. So it is truly my honor to welcome back our expert today, Jean Hartford-Todd. Thanks so much, Jean, for being here.
Thank you, Erin. It's just a pleasure to be here.
Wonderful. We know that this is not the easiest conversation to have, especially when we are talking to the youth in our household. So we so value the information and tips that you provide to our community.
Thank you. It's
So I
something
think,
I'm passionate about.
yeah, I mean, clearly with all of the work that you've done. So um, with that, I want to jump right in and start with a pretty broad question about this subject. So, for parents, how do they explain cancer to their child?
Sure. I divide kids into groups when I think about that question. Children who have the ability to understand cells and cell division, and children who don't. So for the younger kids, you can say, I have a spot of sickness in my body that's not supposed to be there. It's in my breast or wherever it is in the body. And I'm going to be taking some special medicine and treatments to try to make that spot go away.
Mhm.
The name of that spot, that cancer spot, the illness spot is cancer. So if you hear us saying that word cancer, we're talking about the spot that I just told you about.
Yeah,
So it's
that's a great way to put it.
pretty simple, and really kids as young as 2 and 3 can start to learn what that means. For older kids, and actually I can share some written information that you can share with folks.
Yeah.
I think about educating about cells and that our bodies are made up of cells. Anything that is alive is made up of cells. And cells are like tiny building blocks. And for these kids who love Legos, you'd be surprised how young of a
That
child can
resonates with them.
understand cells once you make the
Yeah.
Lego analogy, right?
Yeah. Yeah. Makes sense.
And so I explained that they're building blocks that make us up, that each cell is tiny, that the period on a dot of paper is bigger than cells. You really can't see them. And then I explain that healthy cells know what their job is in the body. So lung cells help our body with breathing, skin cells make our skin so we're all covered all over, and so on. And that these cells know how to divide. And the reason they need to divide is because sometimes our body needs more cells, right? So, and I say to kids, as you grow taller, your legs need to be longer, your arms need to be longer, your body needs to be bigger. And so what's going to happen is one cell is going to divide and become 2. And then 2 cells divide and become 4. And healthy cells know when to start dividing, they know when to stop dividing, and they know when their job is done and they can just die off and they're not needed anymore. And then I explain that cancer means that some of the cells in the body were damaged and they no longer follow the rules. They don't do any helping job for the body. They don't know when to, well, they know when to start dividing. They don't know when to stop dividing, right?
Right.
Right. So, and they divide very, very fast, so fast that they can crowd out the healthy cells in the body. And even with very young children, where I'm just referencing that spot of sickness, I'll say the spot of sickness tries to grow bigger and it sometimes tries to move to new places in the body. And so you can explain that with the cell division as well, that sometimes cancer stays in one place in the body, but sometimes it really tries to move to more places in the body. And then it's always nice to pair that with a conversation about treatment so that as you're telling them what cancer is, you can say, and this is what we're going to do about it. And so I can speak more to treatment later, but if you have the luxury of waiting until you know your treatment plan before you tell your children that you have cancer, that can be a really nice way to support them, is by being able to say, this is what we're going to do to treat the cancer.
Yeah. Yeah. I love the simplified version at which you explained it. I mean, I think just saying like it doesn't play by the rules, but not in a way, you know, that seems oversimplified. You still are getting the point across.
Yes,
Yeah.
and I will say, I would say over 50% of the time when I do my educational session with children around this, the parents in the room say, I am so glad we did this. I did not know all that information. Yeah.
So helpful, right? So everybody's on the same playing field, essentially.
And that's, so I will send that to you in writing, because
Perfect.
for those of you listening, if you have never had biology or you haven't had biology since high school, you
Right.
might not know that, right? That
Right.
piece right there.
Right. But it's enough for all of us to understand. I love that. So we'll make sure to include that with this recording in our video library for sure. Thank you
Perfect.
for that.
Yeah.
So for younger students, preschoolers, you know, I've heard from a lot of parents that wonder if they really need to use the word cancer. Like, is that important to use that term, or could they just say they're sick? What, what's your guidance around using and using that specific word?
Sure. I do encourage parents, even with kids as young as 2 and 3, to use the word cancer.
Okay.
In large part, well, 2 reasons really. They're going to hear it, right? They're going to hear it, and I want them to know that that word cancer means the sickness you've already told them about, not something new that they haven't been told about. I also, for these younger kids, if we only call it sick and then they get strep throat or an ear infection or a tummy
Right.
virus where they're vomiting, like mom or dad is vomiting from chemo, they
Right.
could easily think, now I'm sick, like my parent. Now I need to go to the hospital. Now my hair's going to fall out and I need to get all these medicines. So using the word cancer gives it a different name. And if they do say, I'm sick, I think my hair's going to fall out, you can say, oh, well, you know, my sickness is cancer and the medicine I take does make my hair fall out. Your sickness is a sore throat, and the
Yeah.
medicine you take will make your throat feel better very soon and it won't make your hair fall out.
Yeah. I love that. And you bring up such a good point, you know, because I think back to as a young child, you know, if I was held from using or knowing a certain word, as soon as I learned it, it was like it made it seem so much worse. You know what I mean? So just hearing you say, if we don't identify and use the word cancer when they may inevitably learn that, it may feel bigger, or you're now really bringing it bringing it to reality a little bit, bringing it to baseline.
Yes, and that is one barrier for parents. And usually with older kids, they won't bring up that word in public places. They've sort of started to learn the social norms and they ask
Yeah,
questions in private or at home. But
yeah,
once you tell a 3-year-old or a 4-year-old that you have cancer, you could be in the line at the grocery store and they could say, "What did you say about your cancer in your breast?"
yeah, yeah,
And there you are. And if that happens, you can say, "That is a really good question, and I want to answer that for you. But right now, I'm busy. I'm going to be paying the cashier soon. And
yeah,
so I'm going to tell you that when we get in the car."
yeah.
And then the deal is you have to bring it up when you're in the car. Don't think, "Oh, maybe they won't bring it up again."
Right, because they will.
That you can say, "Do you remember what you asked me about the cancer in the store? Would you like to talk about that now?" If they say yes, you can. If they say no, you say, "Okay, I'm happy to talk about it anytime."
Yeah. I love that. You're really open, keeping that door open and really allowing them to be the guide for when they're
Mhm.
comfortable speaking about it. You're letting them sort of drive that conversation.
Yes. But
I
also
love that.
protecting yourself because you do deserve some protection.
Absolutely.
Yeah.
Yeah, absolutely. So when we get into conversations or, it may evolve into a prognosis
Mhm.
for a parent. How does a parent have that sort of conversation? Because that in particular can be quite a challenge, quite emotional, quite difficult on what to share or how much to share. How does a parent work through that conversation?
Mhm. I like to start at the beginning with diagnosis. So I would hope that any child, let's say at least over the age of 6 and older, and
Mhm,
I can talk about why I do this age division. I would hope those kids know some people do die from cancer, but many, many people don't die from cancer. And it can be
mhm,
very scary to bring that up on your own. So you could say something like, "You might hear things about cancer at school or on the news, and I want to make sure you know what's true and not true. So
mhm,
you might hear that cancer is contagious and that you could catch my cancer from me, but that's not true. Cancer is never, ever contagious. It's impossible." And I say with kids, I say, "Could your mom's stomach jump out of her body and jump into your body?" And they
mhm.
laugh and they say no. And I say, "Cancer is just like that. Cancer's
Yeah.
not a germ. It's not an infection. It's not a virus. It is a part of the body." Then you can say, "You might also hear that people die from cancer." And that part is true. Some people do die from cancer. But you know what? Many, many people don't die from cancer. They take the
Mhm.
treatments. The treatments are stronger than the cancer, and the cancer goes away forever. And so that's your starting place so that your child isn't caught off guard if they hear that.
Yeah,
Then as
I
time
love
goes
that.
on, yeah, you can in update them not so much about your prognosis to start with, but you can say, "Wow, when I went for my checkup, the doctor saw a new spot of cancer, so that means it's time for me to start a new medicine."
Yeah,
Now, if kids ask about prognosis, you can answer it. But if they don't, it's okay just to give them that update. Okay.
yeah.
But let's say the cancer continues to progress. It would be the same thing where you update them in the moment about your treatment plan. If you get to a point where it looks like maybe there's one more treatment option available, and
Mhm,
then you do know that a transition to hospice would likely occur,
mhm,
at that point, it's a judgment call. I know many parents who do tell their kids, even as young as 7 or 8,
mhm,
that, "Well, we're going to try this one more medicine, but if that doesn't work, I will stop the cancer treatment, and it's likely that one day I will die from the cancer." But it's
mhm.
also okay with a lot of kids if your health isn't declining in a way that they really see you getting sicker and sicker. I think that's the
Right.
key. What are they
Okay.
seeing? What are they wondering? What are they worried about? And I also, and this is so important, think about how your children perceive time, right? Preschoolers think about what's going to happen in the next few days, maybe the next week, but they
Right.
don't even really understand what a week is. 7, 8, 9-year-olds, they can think more into the future. Okay. So, what we're trying to do is update children within the context of how far out into the future they can think and understand.
Yeah,
Yeah.
that makes
Yeah.
so much sense. And what you're sharing is, you're doing it in a way that leaves the conversation open if they have more questions or if
Exactly.
they hear things at school, like you said. So you're
Mhm.
sharing enough, but still allowing them to be a driver.
Yes. And the first step that I typically encourage families to take is this transition from talking about cancer as an illness you're trying to make go away,
Okay.
and now acknowledging to your kids, my doctor has realized that the type of cancer I have probably won't go away, and I will always need treatment for it. So your first shift can be from more of a, illness that we can cure to an
Right.
illness that you'll always have to live with.
Okay.
And you don't even necessarily have to define how long you will live.
Right.
Again,
Right.
that depends on how old your kids are, how far into the future they can see.
Yeah.
If they
Yeah.
ask you directly, you can say, some people do die from cancer, and I will live with cancer for the rest of my life. And then you can choose from 2 words here. You can say, it is possible that cancer is what I will die from one day. Or you can say, it is likely that cancer is what I will die from one day. Okay, depending just on what you've heard from your doctors, how far into the future you think your kids can imagine.
Right.
And then you can say, if it's true, but I'm not dying now. I am
Right.
alive. I'm living with cancer. And just like I've done so far, I'm going to tell you the truth as I go see my doctor and get my checkups.
Yeah.
Mhm.
I love that. You're using 2 words. It's possible that, or it's likely
Likely
that,
that.
based on
Mhm.
child's age, prior discussions, that sort of thing. I love that.
Right. And with so many metastatic cancers now, we have treatments. I mean, I've done this 38 years.
Yeah.
It used to be with a stage 4 cancer diagnosis, I was ready to talk about end of life, right?
Yeah.
That's not true anymore.
No.
So if you can live with stage 4 cancer for years, think
Hmm.
how scary it would be for your kids to wake up every day thinking, is today the day mommy's going to
The
die?
day.
Is this the week
Right.
mommy's going to die? So that's
Right.
where really trying to figure out how far into the future they can see and then giving them the information to deal with that.
Yeah.
Yeah.
Oh, so such good tips, such good guidance.
Yeah.
So in these conversations that we're having with our children,
Mhm.
how does their school and their teachers and the administration, um, how does a parent, communicate with their school community, or do they? What are your thoughts on that?
I would encourage families to reach out to the school with one caveat. If you have teenagers who really, really, really don't want people to know, they don't want to
Yeah.
be seen as different, I'm just going to set that aside for a minute. Okay.
Okay.
So for the younger kids, absolutely email the school counselor and their teacher. Explain, at least in general terms, what your treatment looks like, so they have some sense of when you'll be able to be home with your child. Will you need to be in the hospital at certain points?
Hmm.
Or do you know you're going to be very tired this week and can't help with homework, that type of thing?
Hmm.
And then ask them just to be another set of eyes and ears for you. And if they
Love that.
notice any changes in your child, to please reach out and let you know so you can get the support your child needs.
Hmm. It
Mhm.
makes so much sense. Yeah, I think another set of eyes, multiple sets of eyes, especially at the younger student population. It's always good.
And parents know, your children. So if you think your 8-year-old would hate it if 2 or 3 teachers came up to them and said, I heard about your mom. Are you okay? Come see me if you
Yeah.
need to. Then
Yeah.
be pretty clear in your email or during your visit. Could they please identify one person who will communicate with the child so that they're not being inundated with, even with well wishes? That's hard for some kids, right?
Yeah. Yeah.
Yeah. Yep. So that's a trust your gut, knowing your child's personality and what would be stressful to them or what would be helpful to them.
Yeah. And just like, any patient would be communicating their wishes or setting those boundaries with their medical team, what you're explaining is the same thing with school administrators, um, just like you said, advising not to, although coming from a positive place, but not, sharing some thoughts or I'm so sorry to hear about your mom, but really just guiding how that looks in the school setting.
Yes. Yes.
Yeah.
And, with
Okay.
younger kids, they love to go see the school counselor. Older kids, not so much. So
Yeah.
if your counselor can see your child once a week or once a month, great if they love it. Yeah.
Yeah. Okay.
Teenagers, it can be more of a conversation. Saying to your teen, I
Yeah.
think it would be a good
Yeah.
idea if somebody at your school knows about my cancer. I wonder how you feel about that. And see how they respond, even if they're very negative and respond in a no, don't do that kind of way.
Hmm.
Just say, well, let's think about this for a few days, but I think I'm going to come back and ask you to identify one person at the school that you feel comfortable with that I can share this information with so that you have a go-to person if you want to
Yeah.
during the school day. There are
Yeah.
some parents and teens who decide they're not going to communicate with the school. And for those families, it's worked out. So I think it's, again, your teen, you know what they need, or you can guess if you're not really sure and start
Yeah.
there, start with your guess. But with teens, I do try to respect their autonomy a little bit around that.
I love that. Yeah, and really including them as part of that conversation and how that
Mhm.
goes.
Yes, for
Yeah.
sure.
Yep.
Yeah.
So I know, these conversations in general are very emotional. In fact, I was just chatting with one of our Unite for Her members earlier, and she was getting very emotional, and she said something to me. I don't like to cry in front of my kids. I want to stay strong for them.
Mhm.
So, we know emotions are healthy and it's okay to experience them, but we hear so often how parents want to stay strong, maybe not show emotion. So, what do you say to parents, when they say like, what do I do if I start crying, if they start showing emotion? What is your recommendations when that happens, which I think in most cases, inevitably it will.
Mhm. I'll start with the ideal and the reality.
Yeah.
Ideally, you actually will feel comfortable sharing some tears and acknowledging that it's really normal for people to worry or to be sad when they have an illness like cancer.
Hmm.
And just say, our family, we can talk about these feelings. And it's okay if you're tearful. What is ideal is if you're tearful and still have the composure to talk to your children in that moment and to
Yeah.
say what I just said, it's really normal. This cancer is going to bring changes to our family, and some of the changes will feel hard. And it's really normal that everybody in our family is going to have some feelings about that. And it's always great to then follow up with, but these are the things we're going to do to cope. So my doctors are going to be helping me with my cancer treatments. Our friends are going to be helping our family, maybe by cooking some meals or helping to drive you to school. And, hopefully you do have at least a small circle of support that you can talk to your child about. There are
Yeah.
times, though, when you have cancer or your loved one has cancer where you need to melt down, even as an adult, and cry hard. It is best if you don't do that with your child, if you either do it alone or ideally with a trusted friend or a family member
Yeah.
or therapist. I don't want you to be alone either. Um,
Right.
but what if you're talking to your child or they walk in on a phone call and you are really upset and can't talk? You go back to them as soon as you feel like you're composed and you say, I know you saw me crying really hard. Sometimes grown-ups cry really hard, just like kids do. I was talking to my doctor and, he said a couple things I wasn't happy about. I was sad to hear. And you can share
Mhm.
what those things are. And then you can say, but even when I'm really sad and even when I'm crying that hard, I'm still mom and I still love you and I can still take care of you. And if I
Yeah.
ever have a day when I feel like I need help with that, then daddy or other mom or grandma or aunt or whatever can help
Yeah.
us.
Yeah.
We have help. We have support.
Yeah.
Yeah. It's
I love
scary.
that you call it is scary, and I love that you call out, really sort of in these emotional moments, identifying those that will help you cope,
Yes.
with all of this, to know that there's outside support
Mhm.
and really providing that additional assistance. I love that.
Mhm. There's one very quick activity that I'll share that I do with kids.
Okay.
And it's great for everybody in the family to do this. You draw or color a tree trunk on a piece of paper. And then if you have the time, using different colored construction paper, you cut out a lot of little leaves. And I call it a caring tree. So everybody puts their name on the tree trunk. And then on all the leaves that spread that you glue to the tree trunk, you write the names of people who care for your family.
Oh,
Okay.
I love that.
Yep. And if you have a small support circle, you can put things that help you feel calmer, like listening to music, going for a
Hmm.
walk, to have more
Hmm.
leaves on your tree. I've had so many parents say, I love this tree. Not just the kids have this visual image of their village, but parents do too.
Absolutely. I think that's a wonderful activity. And like you said, not only for parents, but for the whole family. I think
Mhm.
visually being able to identify not only the people that are leaves on your tree,
Mhm.
but other things that provide comfort, relief, support.
Yeah.
Like you mentioned, music. I love that.
Mhm. And
What a
if
great.
you don't feel well enough to do that and you have friends saying, how can I help? How can I help? You say, can you get some paper and paint some tree trunks on it? And can you cut out some leaves from construction paper and buy a
Yeah.
couple glue sticks and, for us?
Yeah.
They would love to do
Yeah.
that, right?
Absolutely. Yep.
Mhm.
Yep. Yeah.
Yeah.
Your support just wants to help you. So giving them direction like that. I love it.
They'd earn a leaf on the tree, right?
Yes, yes, they have. They've earned their own leaf. They can then
Yes.
decorate their own leaf and add it to it. I love that idea.
Yeah.
Okay.
Yeah.
So you mentioned this earlier in the talk, Jean, about
Mhm.
getting a little bit into the specifics around treatment, side effects. So,
Mhm.
how much detail do you advise parents go into regarding treatments and some of the more obvious side effects that someone may experience? How do they work through that conversation, or how much detail do you advise they go into?
Mhm. So I absolutely recommend that you share the side effects your children will observe or
Okay.
hear about. And the main reason is kids misinterpret what they're seeing and they think that these things are happening because you're getting sicker, not because it is a normal, expected result of the treatment.
Right.
So to say, I want to tell you about some changes that are going to happen. And these changes will not be from the cancer, but from the medicines.
Yeah.
The doctor said the type of medicine I need to take will make my hair fall out. Now, that can be sort of a fun, silly conversation if the adult with cancer feels like they can use some humor or not, if you're not feeling that way. Because,
Hmm.
you can say, isn't that kind of crazy that there's a medicine that makes hair fall out? Or you can say, I'm not really looking forward to that, but I wonder if you'd be willing to go to the store with me and help me pick out a hat or two to keep my head warm and that I like the looks of.
Yeah.
Okay.
Yeah.
Um, Usually fatigue, nausea and vomiting, and uh, hair loss are the big ones.
Okay.
But then once you've told them what you really think they'll notice, you might figure out there are some others, like cold sensitivity, so that you're not reaching into the freezer anymore. So if all
Mhm.
of a sudden you're noticing that's happening, then you just comment on it. Oh, this is something new that's happening from the medicine that I take for the cancer, just like it made my hair fall out. It makes my fingers feel much more sensitive to cold.
Mhm.
And again, to let them know that this is normal and okay and expected. It's, you don't like it. You know, we wish
Right.
these changes from the medicines didn't happen, and doctors or scientists are still trying to figure out how to create cancer treatments that don't cause these other changes.
Yeah.
Yeah. I I
So
think
good.
for all of what we're talking today, what I say is you want to help your children make sense of their world. Okay. And if their world includes these changes, then they need to have information to help them understand.
Mhm.
Mhm.
Really thinking about it from their perspective as
Mhm.
a guide.
Mhm. And some side effects, like feeling very tired, might be from the cancer or the treatment. And you can be honest about that. You can say, you know, the cancer makes me a little bit tired and the treatments make me really tired. So
Mhm.
that's from a little bit of both.
Okay.
Mhm.
Okay. Good tips. Now moving on a little bit to a really difficult topic and conversation to enter into, but uh, you've alluded to this a few times, things that a child may hear, right?
Mhm.
And so if a parent has a child that comes to them, maybe it's from something they hear or just a thought that they have, if they ask if the parent is going to die,
Mhm.
uh, I know you mentioned this earlier, but I think it's worth covering again. How does a parent respond to that, or how can they answer that question?
Mhm. To that direct question.
Yeah,
Again, I'm going to divide the kids up into different age groups,
yeah.
acknowledging fully that no child is a textbook. So, yeah, the textbook says children this age understand this about death, and this age they don't. But this is another, you know, your child. So there's some wiggle room there. For 4 and 5-year-olds, and maybe some 6-year-olds, unless your death is imminent, I think it's just okay to say, you know, everybody dies one day, but I'm not dying right now. I'm alive. I'm living with cancer. I'm taking my medicines.
Hmm.
And the doctors think I'm going to do this for a long time, because to a 5-year-old, 4 months, 5 months, 6 months is a long time. And especially years that you might be living is a long time, right?
Hmm.
For older kids, you can say some of what I said earlier. You can say, you know, everyone dies one day. Everybody dies from something. I don't know what I'm going to die from. Could it be the cancer? Maybe. But I could be older and it could be from something else, because the doctor's really trying to make my cancer go away completely. And that's my hope. And that's what that's what we're working towards. I think what
Yeah.
gets a little tricky, even if you have a low risk cancer and you just flat out say to your child, no, I am not going to die. We just never know. First of all, everybody does die one day, right?
Right.
And we just don't know. So it's really better to go back to, um, some people do die from cancer. Many people don't die from cancer. My doctor has told me that the type of cancer I have is easier to treat than some others, and they're expecting that it will go all the way away. If I ever hear any different news than that, I will tell you. I won't keep it a secret.
Hmm.
Yeah. So
Yeah.
you
And
can
and
share
that
what's expected with your cancer, but leaving that door open.
and I think that that's a really good point. Just having your children know that they'll be made aware, right? Okay, that's a great answer, and they kind of are up to speed. But if things change or when they change, that that they'll be part of that discussion. They'll you know
Mhm,
they'll have that conversation. Is certainly reassuring, I'm sure.
mhm. It is. And during my educational session that I do with just one individual family,
Hmm.
I will, one of the questions I cover is, have you ever heard or wondered if somebody can die from cancer? And often it's the 6-year-old who says, yes, I heard that on the news yesterday. There was a man and and the
Oh,
parents are going, oh my gosh, we didn't
yeah,
even realize he had any knowledge
right,
of this.
right.
Hmm.
Yeah. So they truly can hear it from anywhere, you know?
Hmm. They really can.
Yeah.
Yeah.
So, having these conversations are so important and I think are really helpful for all family members. I'm curious as to your thoughts on how often a parent should be or a guardian should be having these conversations with children. Is it something that's necessary to do every day or when things
Hmm.
change? And sort of in those conversations, um, how does a parent know if maybe their child may need some counseling, some more professional counseling, therapy assistance? How do you
Hmm.
identify that?
Once you're beyond that, what I call the whirlwind of diagnosis, that those first few weeks where you're getting so much information and you might be talking about cancer more often. After that, I think it's okay if it comes up monthly, and typically it comes up in the context of normal conversation.
Yeah,
So I have an appointment tomorrow, so Mrs. Smith is going to pick you up from school and you'll go home to her house
right.
with Molly, and then I'll pick you up for dinner. So
Yeah.
just some of those touching base conversations are fine.
Hmm.
If you don't have any specific updates about your cancer, that's great. You don't have to just bring it up, as long as you're having some of those touch points.
Hmm.
And if you ask your kids, do you have any questions? Are you worried about anything? Most of them are going to go, no, no.
Right.
So another way to check in and ask that question is to say, of all the things you think about when you think about this cancer, what do you think about the most? Because for
Mm-hmm.
kids who are avoidant and talking about feelings, you're not asking
Hmm.
about their feelings. Um, and it's a pretty wide open question, and you're not even giving them a question. It's open-ended, meaning they can't easily say yes or no. They kind of
Right.
have to answer it a little bit. I mean, they could
Right.
say, I don't know,
Yeah.
but at least you're trying.
Yeah. You're coming at it from a different angle.
Yeah. And then
Yeah.
if they do share what they think about the most, sometimes that will lead you to something they would like to talk about
Hmm.
or need to talk about.
Hmm.
As far as wondering if kids need help, need support, some of the research shows that teens do voice having more distress about a parent than younger kids do.
Yeah.
And I'm not saying younger kids don't have any distress, but some of the research does bear out that that distress is there. And then they're also dealing with maybe friends who are pressuring them to do this or that or the other thing. So keeping that in mind. What I encourage is if you are noticing any behavior changes in your child or teen, changes in eating, changes in sleeping, changes in their ability to separate from you, to go off to school, changes in their
Mm.
grades,
Yeah.
and those changes are so intense, so frequent, or so long lasting that you think it's impacting their ability to mostly be a happy kid,
Hmm.
who, yes, admittedly has some moments of distress because cancer is hard.
Hmm.
If if they're happening so frequently, so intensely, or so off, lasting for so long, then I would encourage you to look for a local therapist or support through your cancer center. If your child is having moments of distress, so a night when they can't get to sleep because they're thinking about your cancer, but then for the next 3 weeks, 4 weeks, 5 weeks, they're kind of doing great, that might just be human, right? A human response to what's going on.
Yeah. Yeah.
Hmm. Yeah. And sometimes family counseling is the best way to go about this because you're not singling out a child or a teen and saying, hey, we think you have a problem with this.
Hmm.
It's this illness is impacting our family, and this
Hmm.
is a support we're choosing to get
I
for
love that.
our family. And then the therapist could help do one of my children need individual, some individual sessions. Yeah.
Right. Right.
Yeah.
I love that. And especially with counseling that can seem scary or intimidating,
Mhm.
or younger children might have a perception about meeting with a therapist.
Mhm.
Bringing the family unit in really kind of level sets everyone, right? And
Mhm.
really brings that intimidation down. That's a wonderful suggestion.
Mhm. And with teens, again, I don't want to avoid conversations about feelings, but
Yeah.
sometimes you have to get in the way you can get in. So with
Yeah.
teens, I'll say, people think about counseling as going in and crying and talking about your feelings. And I say counseling can be that for sure if you want or need it to be. But therapists are also experts at helping you brainstorm and problem solve some things that are on in your life right now. It might be trouble you're having with a friend. It might be you're distracted during math class because your parent has cancer. And how do you shift your focus back? Or is there a way to shift your focus back
Right.
if you're distracted?
Yeah, yeah, I'm sure that happens, but that's a skill that is really hard for all of us, right? To
Mhm.
reshift our focus. So, identifying, those learning opportunities. Oh, so great.
Mhm. Yes.
I love that. So good. Okay. Well, I know we have just a few more minutes with you, Jean. And for
Mhm.
those that are watching live on Facebook, I encourage you to put any questions in the chat while we have her. We did have one question came in, which I thought
Mhm.
was a really wonderful question, because I often think, these conversations are centered, of course, around a patient and what they may experience.
Mhm.
But certainly, one of our questions were, how do you talk to children and teenagers that they could possibly have the BRCA gene, and how that could affect them later in life? I mean,
Mhm.
because now, I'm sure that the child or the teenager now feels personally involved. So how do you work
Right.
through that conversation?
Right. Um, there are different ways I think about this. If you are someone and your loved one has cancer and you're being tested to see what your cancer risk is,
Hmm.
that's a bit of a different conversation than if you have cancer and you were tested because of your own cancer, and then the impact is on what might happen for your children. Both of these scenarios could impact your children, but they impact in a slightly different way. So I'm going to
Right.
operate from the people listening have a cancer, and you've found out that you test positive, and you're
Hmm.
wondering if you should tell your children and how. In some ways, the sky is the limit. There are families who tell their 7-year-old about this, and there are families who have not yet told their 21-year-old.
Hmm.
And then there are different areas of expertise. So I'm not a genetics counselor, and some information that you need to help you make this decision is statistically, how likely is it my child will be impacted by this? Um, if they do turn out to test positive at some point in their life, usually people are tested once they become young adults, unless
Hmm.
it's some of the genetic syndromes that could cause a childhood cancer. But we're talking about the BRCA gene, so that is not a mutation that would cause a childhood cancer. You definitely want to know from your physician or the genetic counselor, at what age do you recommend my children get tested? Because that's a
Yeah.
cutoff date, right? You want them to be
Yeah.
tested as early as possible. And at what time should they start their own screenings or prophylactic or preventive treatments, whether it's surgery or
Right.
whatever? I think you can say, even to your 8, 9-year-old, 10-year-old, if that, when somebody gets cancer, doctors are always trying to figure out if there's something that caused the cancer. And um, I had a blood test that shows that there's something in my cells that made it more likely that I would get cancer. And it's possible that other people in my family could have that change in the cells also.
Hmm.
The important thing with the younger kids, as opposed to the older teens and young adults, is they have to be able to understand that we're not talking about getting cancer from your mom or dad. We're talking about getting the risk of cancer.
Right.
If they can't grasp that concept, it is fine to wait until
Yeah.
they can understand it's not the cancer that will go from you to your child. It is the likelihood that they will get
Right.
cancer,
Right.
right?
That's a great observation. I
Yeah,
sort of liken it to what you were saying earlier. If a young child thinks it's infectious, right? Or they might get
right,
it from, sort of in that
right,
same vein, how they might also think this is something similar to that, and
right.
confuse it that way. Yeah.
Yeah. So they have to be able to grasp that.
Mhm.
The other thing I'll say is if you choose to wait until your kids are quite a bit older and you feel like you are harboring a secret and it is uncomfortable and it doesn't feel good, you can't just relax and say, well, no, I think this is the right time to tell them, and then so that's what I'm going to do. Then that
Mhm.
needs to be addressed for your own comfort, and because that little voice might be telling you it's okay to go ahead and tell your kids now, and let's get you some help, whether it's from a therapist or someone at the cancer center, in
Yeah.
telling that.
Yeah.
Yeah. So I don't want you to feel like you're harboring a secret. I would rather you have this sense of, I have a good sense of when I should tell my child, and waiting until that time is okay with me. I'm
Yeah.
comfortable with that.
And to help that frame of mind, I love that you mentioned, like, speaking with the genetic counselor, just looking at risk and age and screening. I think
Mhm.
that's having that insight from those that work in this space as professionals can
Yeah.
also really be helpful in someone sort of looking at that timeline of when they may have that conversation.
Right. And if you do have the conversation with your children of any age, they need to know that if they ever test positive one day, it doesn't mean they will get cancer,
Right.
right? It's
Right.
not definite. It
Right.
just increases the possibility.
Right.
And they also, you need to talk to them about, even though it's hard information to hear, why it's good to know this. Because now that we know this, there are actually things when you are an adult that you can do to reduce the chance that you will get cancer, and you don't necessarily have to go into preventive surgeries unless your child is asking specifics. It's okay
Right.
just to say, there are things that you can do to really reduce the chance that you'll get cancer, even less than what this test showed.
Yeah.
Yeah. But it is
So
scary,
good.
and I don't want to minimize how hard that conversation is.
Absolutely.
Mhm.
Absolutely. But just like with all of this, it's a matter of having the tools and
Right.
understanding phrases and words and the approach so
Mhm.
that you feel comfortable, the child understands, and just sort of leaning into resources and experts that can help you walk through that conversation.
Mhm. Yeah, and with this, and should you use the word cancer, you always have to ask, if I don't tell my child, are they going to hear it from somebody else?
Right.
Right? Because if they're going to hear it from somebody else, and you can't control what your mother says or what your sister says or what the neighbor says,
Right.
then you might need to, even if you have some discomfort, go ahead and share this so that, again, your child is protected and they hear it from the person who loves them most, who will tell them in the privacy of your living room, not at a family party where they overhear somebody.
Right.
Yeah.
Right. Right. Yeah. All the things to consider.
For sure.
Ah, yep. Jean, this has been wonderful. So much good information. I don't see any questions that have
Okay.
come in from Facebook, but I think the tips and even the phrases, that you've imparted on us, that parents and guardians and caregivers can use to enter into these conversations, are just so helpful. And I know that will be really useful to share with our community as they're just trying to navigate this and navigate changes and these new conversations. So we are so grateful to have you with us today.
It is a pleasure. I enjoy thoroughly working with you and with Sue, and I'm happy to share this information.
Wonderful. So for those that may be in your area around Duke,
Mhm.
they could connect with you directly. Do you have any other resources that you like to share? Because we do have, community members in all 50 states. So I know you mentioned speaking to their oncology team if there are
Sure.
resources, but any other organizations that you recommend that can also be part of those leaves on that tree?
Sure. And I will just clarify, my services are available for Duke patients,
Hmm.
and we have another child life specialist. Our support group for children and teens is more broadly open. But
Great.
for those of you who don't live within an hour of a Duke Cancer Treatment Center, there's an organization in Texas called Wonders and Worries, and they have a parent hotline where you can call and ask some of the same questions we've addressed today. They have parent webinars where you can log on like you are here and learn information about these topics. And there's a support group that is really only 3 or 4 years old called the Pickles Group. And you can search on that. And that is for children and teens who have a parent with cancer.
Okay.
Okay. And it is run by volunteers with professional leadership, but all of the volunteers are either school teachers or nurses or people who know children, know what
Hmm.
they need to hear, and then they get some training specifically around how to, run these groups the way that children need.
Perfect.
Yes.
Two great, wonderful organizations. Yep. Yeah. Two great organizations. We love that.
Yes.
And your support group that you run for Duke patients, is that in person? Is it virtual? Do you have the option?
Our families have chosen to remain virtual, and so we have only 4 in-person meetings a month, and a couple of those are just parties.
Yeah.
What we had to do though is during COVID, we were getting requests from across the country to join our virtual support group. And that shows how much it was needed. And some of that was before the Pickles group came to be. So if you are not being treated at Duke, you have to live within an hour of a Duke treatment center to join our Kids Can support group.
Okay.
Because before COVID, it was a community group open to anybody who um, could drive to Duke on a Monday night, right? But
Yeah.
now that
Yeah.
it's virtual, we had to just put that parameter in place so we could serve
Of course.
our patients as well.
Yep, but it's good. It's good to know these other organizations exist. And as someone that, like you said, has worked in this space for more than 3 decades, to know that they're trusted resources. I mean, we trust you with sharing high quality
Mhm.
organizations and support networks. So we will be sure to put both of those links in our Facebook chat, and
Great.
we'll include them with the recording as well for those that may be interested.
Would you also add Camp Kesem?
Yes,
You know, Camp.
absolutely. And yep, know them
Please,
well.
yeah.
Yeah.
If you're listening today, look into kesem.org.
Yeah,
It's an amazing
they are so
program.
good. We had a representative on from Penn's Camp Kesem over the
Yes.
summer. Check out our speaker series when they joined us. But we know that they have camps and chapters all across the country. So it takes a village. So good to know that all of these resources are available.
Yes.
Wonderful. Jean, thank you so much. We are so grateful to you. I know parents and families are just so grateful for the work that you do for children and navigating this really difficult space. So I know you're busy, so we appreciate your time with us today.
Thank you so much, Erin.
Absolutely.
All right.
So, with that, we will wrap up our Ask the Experts this afternoon. We are recording this, so know that it will be in our library as soon as probably this afternoon or tomorrow. So please come back to re-listen, share this segment with those that you know may find it helpful. Jean shared a lot of information, so I always think a re-listen is always a good idea for all of us. This is not a conversation that's easy for anyone. So really good tips, phrases, so much good information. So this will be up on our Her Library, uniteforher.org/her library. Again, remember, this is one of 2 Ask the Experts that we are hosting this month. So next week, October 30th, We will be streaming live again to Facebook, 4 p.m. Eastern Time. I will be joined with Sue, cosmetic and medical tattooing with Mandy Solar of the Solar Institute. So really excited to not only dive into this conversation, but learn about the advances that have really been made in eyebrow, nipple tattooing, micro needling, eyelash, hair thinning procedures. So much that patients can lean into because we know that that also is part of whole person care. And then finally, I want to thank our sponsors. So our digital education events today are presented by West, Merck, and Daiichi Sankyo. And of course, we have additional support from Lilly, GSK, Gilead Sciences, Pfizer, and Immunogen, now part of AbbVie. So thank you everyone for tuning in this afternoon. Hopefully we will see you next week. Any ideas on future topics, know that we're always looking for what is important to our Unite for Her community. But otherwise, we will see you next time. Enjoy your afternoon.